everybody. Welcome to our next episode of the podcast. I'm Apoorva Gomber, an NCDChild young leader from India, and I am here with my co-host, Alex. So over to you, Alex.
Hi, my name is Alex. The introduction, I'm a clinical researcher by background. I'm a NCDChild young leader. I'm based in Vancouver, Canada, and I'm really excited to be co-hosting today's episode alongside Apoorva. And yeah, super excited. Over to you, Apoorva.
Thank you. So, welcome to our awareness raising podcast series, Stand Up, Speak Out, where we aim to tackle stigma and discrimination of people, specifically youth living with NCDs and even their caregivers. The WHO defines NCDs, also known as chronic diseases, as those with long duration and are as a result of multifactorial genetic, physiological, environmental, and behavioral factors. The four main types are heart disease, cancer, respiratory disease, and diabetes. But it's time to move beyond those 4x4. In early 2021, we NCDChild young leaders and the people living with NCDs had a technical group meeting and created an online survey, which served as a consultative process to gauge whether youth living with NCDs had experienced stigma and discrimination, and uh, and what is the preferred platform to voice their experiences. A majority of the participants indicated that participating in a podcast series would be a preferred platform to amplify the voices of the unheard. Guided by this consultation, the Stand Up Speak Out podcast series aims to understand the lived experiences of people living with NCDs, highlighting their various experiences, their narratives of stigma and discrimination, a neglected issue within the realm of NCD advocacy. And today we have the powerful advocates from around the globe, Johanna and Anu, who will be sharing and voicing their experiences with stigma. The importance is stigma can look very different for every person, but your story is your own and it truly matters. So over to you first, Anu. Could you tell us and the listeners about yourself and about where you come from and your journey as a person living with NCD?
Yes. Hi, everyone. Thank you, first of all, for this opportunity. My name is Anu, and I'm from Nepal. I'm an NCD advocate, and I also advocate for cardiovascular health for everyone because I'm a person who is living with rheumatic heart disease for over 22 years. And I'm a public health practitioner by profession and also a global health student. And yes, before I came to this NCD advocacy world, I didn't know much about the power of people living with NCDs. We have the voice and we can share our experiences and challenges with others who are also living with similar or a bit different than this. But yes, I'm recently working with the NCDI Poverty Network. I completed my 18 months fellowship as the Voices of NCDI Poverty Advocacy Fellow, where I was involved in advocating for the investment in NCDs and the promotion of NCD interventions, such as the package of essential non-communicable disease intervention plus PEN plus at the global, regional, and national level. And as a part of my individual advocacy project in that Voices Fellowship, I'm now initiating a small advocacy project called Connecting Hearts to End Heartbreak, which in short term it's Cheer Hearts. And the project aims to increase solidarity among people living with NCDs. And also increase the health literacy and decrease self-stigma and public stigma. After the fellowship, I'm now serving as a member of steering committee and the Pain Plus Cardiac Expert Group, as well as the Advocacy and Financing Working Group of the NCDI Poverty Network. And there I represent the voices of people living with NCDs. And also, as a board member of Global Alliance for Rheumatic and Congenital Hearts, Global Arch, I am involved to ensure continued care of patients and childhood onset of CVDs like congenital and rheumatic heart disease. Yeah, this is something about my regional and global involvement. But in Nepal, I'm involved with the Pain Plus implementing partner of NCDI Poverty Network, which is Kwok. It's a Kathmandu Institute of Childhood. It's a children's hospital network, and here I'm working with my surgeon. So it's an amazing experience to work as a colleague as well as being a person who was operated by him. So it was all very interesting, and yes, I think I should stop here.
Thank you so much, Anu. So this is one person trying to change the world in Nepal. But imagine there's so many people and voices out there who are trying to make a difference. So we'll shift the lens now to Johanna. Johanna, same question. Tell us and the listeners about yourself and where you come from and your journey as a person living with NCD.
Hi, I'm Johanna Ko. People call me Jaco. I live in the Philippines and I have type 1 diabetes for 21 years. I am a diabetes advocate, and at present, I'm in the learning and development field for Action for Diabetes. It's a UK registered charity helping type 1 kids living in Southeast Asia. And I'm focusing on Hello Type 1. It's the digital platform to educate, engage, and empower young people living with type 1 diabetes.
Thank you so much, both Anu and Johanna. I've seen your journey as a person living with and how it transitioned into advocacy and how you've been advocating for other people who've always felt lost in this battle and this journey of their NCDs. And I feel that advocacy for us people living with NCD starts from day one we get diagnosed, because we know what is best for us. So thank you so much for joining this podcast. So over to you, Anu. I know you shared your experience as a person living with rheumatic heart disease. Could you share and expand more about how your diagnosis was, and did you feel supported? And now that you're working with your surgeon, how has the circumstances changed over the course, being a person, patient, and also now an advocate?
Yes, it was back in 2001 when I was diagnosed with rheumatic heart disease in my first visit to the tertiary level hospital. But I should say my diagnosis was a bit late because of many factors. One is myself and my family, and other is regarding the health system. When I was having severe tonsillitis, me and my family, we just thought that it's a simple tonsillitis and it will pass away after taking some medicines or some herbal treatment. But as a child, I used to avoid medicines as much as I could. So yes, the irregularity in my treatment process, as well as lack of knowledge about what the signs and symptoms are referring to regarding my health, it eventually affected me, and I was suffering from rheumatic fever, which again then affected my heart valves and turned into rheumatic heart disease. So when I was 11 years old, I was diagnosed with rheumatic heart disease, and that was the year when I was first operated. And my mitral valve was repaired with a ring, and after that surgery, life went on, but with many challenges as a child, as a young female, and also my parents, they had to suffer a lot regarding financial stress and as well as emotional stresses. And again, back in 2016, I again felt severely ill. My heart rates were kind of double. It was about 160 per minute, and it affected me hugely. I was almost about to die, I should say, because of the conditions that were recorded also. And at that time, I was operated again. My mitral valve was replaced with a mechanical heart valve. So right now I'm under medications. I'm under beta blockers also in order to prevent my irregular heartbeats. And yes, it has affected me in many ways. It affected my education performances, my work roles also. At times I couldn't give my best in my academics, also in my work, and I feel a bit of I was kind of self-stigmatizing myself because of my condition, which right now, if I look back, it was a wrong thing that I did. And I will talk about this later again. But yes, it is interesting that in this after this fellowship, I got chance to work with my surgeon, as I mentioned before also. And now it has been a really interesting journey to look from the patient perspective as well as the public health perspective, and also co-work with the healthcare practitioners. And yeah, it's great. And there are many areas where I want to focus on to continue work and advocate for people living with NCDs, rheumatic heart disease, and other conditions also. But yeah, it's great.
Thank you, Anu. That's really powerful. And I've seen your journey closely through a lot of blogs which you've written, and those are really powerful. And I know it wouldn't have been easy. And that's what is the challenge for NCDs. Like, we could see a smiling face, but inside, you know what you're going through. It's an invisible disease. So I would like to hand it over now to Johanna. Johanna, I know you. I know you personally. We've met so many times, but could you share, like, from the same invisible disease concept? Like, could you share your journey as a person living with type 1 diabetes, and how that invisible disease, you made it gradually visible so that people accept, and how has it been working in as a female in Southeast Asia?
Type 1 diabetes is definitely an invisible disease because we don't look like we have chronic illness. We look healthy, but deep inside, we are facing a lot of decisions, challenges, burnouts, stresses. So sometimes, or most of the time, it is easy to be misunderstood, especially when you don't have the time to explain everything about type 1 diabetes. Because sometimes you don't want to have labels, or it's just that's your decision, but why would others be questioning it, or there would be doubts. So it wasn't a smooth ride, but it's I think I got strength from other advocates that led me to speak my own voice, also to share our voices. So that's how it is. Most of the time, it's been a quiet area in from my place. But when I got to expose more advocates, especially international ones, like you and others, oh my, I was so empowered, and I was in this belief that, wow, oh wow, it's only if we speak more about it that others could also feel the same encouragement and empowerment.
Thank you, Joe. That's powerful. And it's amazing that how we all find our voices while we have all gone through the pieces of stigma and discrimination, like Anu pointed out about. Sometimes it comes from within, or sometimes it comes from the society around us. So going back to Anu, Anu, like you highlighted about feeling self-stigmatized. I like, even if you were you at the age of 11, you were diagnosed and you had to go through challenges at school and everything, but you highlighted like you were also feeling self-stigmatized. Could you explain more about that feeling and what more can be done to overcome that?
Yeah, this when I was diagnosed, and I looked to my friends. They were all playing and involved in many activities like dancing and other exposures, visit to other places. And I was back in my room, in my home, just laying down and on taking medicines, and the penicillin injection that was so hard, painful. And this all made me think that I'm ill. Yes, I'm ill, but I'm weak. I am not able to be as equally active as my friends, and maybe this is what I have to live with, this condition for lifelong. And it eventually affected my performances also. the way that I present myself to others, I felt shy. I couldn't tell the people the things that I wanted to share in a confident way, and in a thought that I am a person who have this condition. As a child, when I was operated, I had a huge, big scar on my chest, and as a female also, I used to feel a bit of discomfort and a shame because I have this ugly scar on my chest. And as a young girl who was growing up, and the adolescent, it changes, the hormonal changes, and the the societal grooming of females to be beautiful. I was kind of feeling not happy with the scar I had, but yeah, those kind of things, it contributed to my self-stigmatization. But once I learned about how much important it is to accept the conditions we have, and to speak for ourselves, and those scars are not the things that makes you feel ugly, but these are the scars that makes you feel the warrior, or the superman or superwoman who have successfully won the battle of life. And now I have totally, I can say I have totally overcome my self-stigmatization. And I would like to thank all the literatures, all the speakers, all the patient advocates, and everyone who were involved directly and indirectly to groom me in this journey. Yeah.
Yeah, thank you so much, Andrew. I think it's very important to talk about self-stigma. It's something that is hard to identify, it's something that is very difficult to overcome as well. I guess the question now is to you, Johanna. What has Andrew touched on self-stigma, and I'm just wondering from your side, how is diabetes perceived in your community, and do you think it has affected the way that you've acted, and also had there been any barriers to the opportunities that you've tried to pursue?
Yes, I think with type 1 diabetes, it's easy for people to perceive that, oh, that's an easy target for younger lifespan, like that, because it's most people get like die so young, and most have type 2 also. So that's the common mentality, like it's an easy target for failing. But it's hard to have that kind of thinking, because instead of being having the warmth, it's easy for people to educate us, even not being asked. So sometimes it's easy to just keep quiet to avoid being picked on. And in terms of opportunities, of course, sometimes it's important to be honest, what we are going through. But if it omits opportunities, it's a disheartening process, especially when you have all your medical records there, that you have all the lab tests, lab works, that you're all good. But because it's misconstrued, then sometimes it cancels out opportunities.
Mm-hmm. Yeah, thanks for sharing that. Anu, I noticed that I remember you mentioned that you also work on stigma and discrimination in your area of work. I'm curious to hear more about some common recurring experiences that perhaps fellow advocates have experienced or talked about. Can you talk more about that, your work around that area?
Yes, the Chair Heart project that I started, so it aims to bring people who have rheumatic heart disease and congenital heart disease together. In the first phase, I'm trying to bring those people virtually, and in the second phase, I will be meeting in person also. And here to address the stigma and discrimination issue, the thing that I have planned is to bring forward the experiences of those who are living with this condition and how they are self-stigmatizing themselves with the condition they have, and also how we can overcome those stigma and discriminations from the patient group and form a voice, maybe it and also record it as a blog or a case story or something that can be published and shared with other community. For example, our own healthcare providers, our own family members, relatives and friends, and other people in the policy making tables. Because from ourselves to our family members, our near and close friends, everyone are equally involved, knowingly or unknowingly, in establishing the stigma and discrimination in this society. And also now we are talking about NCDs, so people living with NCDs are also facing this. So I think we need to touch every people in this. So with my project, I'm starting to do this. And in the Voices Fellowship also, I worked with other 3 fellows who are living with different NCDs, for example, type 1 diabetes, sickle cell disease, and cancer. One of my fellow friend was a childhood cancer survivor. So while discussing with them the common challenges regarding the stigma and discrimination was something like that. And if we we decided that if we work together to address this, we can make the changes. And my involvement with the Global Arch also is encouraging me to work on this, because there are many people living with congenital heart disease who are again suffering from the challenges of being stigmatized and discriminated in their society. So yeah.
Thank you so much, Anu, for sharing that. And I know this is not easy for anybody to share about stigma. And with the work you're doing, trying to connect hearts, you're trying to connect more people to voice their individual experiences as stigma. Like I initially said, stigma can look very different for every person in every community. And we are trying to unleash that through this podcast series as well, to understand what we can do best to bridge this gap of stigma within NCDs. So thank you for sharing that, Anu. Over to you, Johanna. Johanna, you had mentioned that you've been working with a lot of patients and also people who are living with type 1 diabetes around the globe. And you've seen stigma in all forms, stigma within communities, especially from Southeast Asia region, and stigma around the globe, which people have shared on international platforms. Could you share something which you feel needs to be changed and something which needs to be done as you've got this experience of working with so many people across the globe?
Thanks, Apoorva. Yes, as a person living with type 1 diabetes, I really value equality. I respect the fair play. I really follow rules. I don't want to be a extra exception, or I don't, as much as possible, I really avoid special attention. I really don't like those. But sometimes, like, for example, for kids at school, we really need to have snacks and more restroom breaks than the norm. So it doesn't mean we want special treatment, but it's just that that's how our condition, our invisible condition, needs. That is what we need. So for that, in that case, we need more understanding rather than being judged like, oh, this kid needs special attention, blah blah blah. It's not helpful. Sometimes it can also destroy self-esteem. So I hope that even on opportunities. Like there are so many brilliant type 1, even athletes from all professions. There are so many that excels. So it doesn't mean that we are a disability or we cannot perform equally as others. It's just that our pancreas is not working and we simply need extra medication to make it work, but it doesn't mean that we cannot perform. So I hope that everyone treats people the same way, and to just be more understanding and to be there to be of help rather than to discriminate and to judge.
Thank you so much, Johanna. I think you brought a really important part to this piece of feeling inclusive, as we are all different and as all our stories create a different illness narrative around us. So that's beautiful. And you've also highlighted a really excellent point, which helps me transition to the next question. And I would like to go to Anu. And Anu, as we are closing the session, like in a couple of minutes, just in 1 minute, in your own opinion, could you share how can we change the way people are living with NCDs and they're not discriminated against? What can we do more to bridge this?
Yes, thank you, Apoorva. So, well, I would like to highlight to focus on health literacy and awareing or educating everyone in this area, starting from the patient and their family members, friends, the areas where they are involved, and also those who are not related with those people, because they all should know, we all should know that living with this condition is a challenging thing. And if we more highlight on stigmatizing and discriminating this, it will eventually affect in the treatment processes, and the quality of life would be really hampered with those conditions. So I think we all need to work together on this. First, self-educating ourselves, and then again sharing and co-working together in this.
Thank you, Anu. And I think you're already leading the way by connecting hearts through your work. So thank you. Over to you, Johanna. Same question. How can we change the way people living with diabetes or other NCDs can be how can you bridge this gap of discrimination in clinical care?
I really believe that talk more about this condition creates better awareness, and with better awareness creates better understanding. And with better understanding this, there's lesser room for discrimination because we understand, oh, that's what this person is going through. And with more voices, this speaks volume, and volume fills a room. So making that kind of space is like an inclusive one. It feels good, it feels safer. So there's comfort in it rather than being disempowered. We are more empowered, and that's a good place to be in. So this podcast is a good area to create that kind of awareness. So thank you for having us, Apoorva and Alex.
Thank you so much, Johanna. And as we are closing down this session, we would love to expand more on this topic. And I know this is a short time to really get into the integrities and the details of stigma and discrimination, but for all our listeners, it's not easy to talk about stigma. And today we have these powerful advocates, Johanna and Anu, who did open up and share their stories. And I pointed out initially, stigma can look very different for every person. So your story is your own. And today, Johanna and Anu have highlighted that it truly matters, that volume fills the room, and that we need more inclusive care when we think about non-communicable diseases. So thank you for listening in. We hope that this podcast provided insights into the difficult experiences and everyday nuances people with NCDs have to grapple with. This is only a tiny effort, one of the many efforts to unleash stigma and discrimination while we address our entire project with NCDChild Young Leaders. So I hope you will join us for our further work, which we are doing. We encourage you to have a listen to our entire series. All our episodes are unleashing the different aspects of stigma, and we love to hear your thoughts about it. Once again, thank you to our amazing guests, Anu and Johanna, who are such powerful voices from their regions and also making a difference through their little efforts and by being on this podcast, helping us unleash and understand more about stigma. We know that speaking out is not easy, but your voice is powerful and very much needed. Thank you to the incredible guests, and I would like to hand over to Alex. And on behalf of our team, want to say that you really matter and your voice really matters. So thank you so much. Over to you, Alex.
Yeah, thank you so much, Anu and Johanna. It's such a pleasure to have you on today and sharing your personal story. You both are outstanding advocates and role models. And you mentioned that health literacy is an important driver in reducing stigma and discrimination. And Johanna, you mentioned about creating an enabling environment so that people living with NCD can thrive and still reach the same potential as normal people. And yeah, we're still thankful for your thoughts and input on this important matter. And I'm so excited about the work that we are continuing working on. And yeah, thank you so much.
Thank
you so much as well.